Good afternoon. My name is Xenophon Xenophontos. I'm the president of the medical staff at Mercy Medical Center. I am a board-certified vascular surgeon. I have been on staff at Mercy Medical Center for over 12 years, and I have been on the executive committee of the hospital for over 7 years. Thank you all for being here today. The purpose of this press conference is to make you aware of the strong feelings of the executive committee of the medical staff about the false information that has been disseminated about patient safety and clinical care at Mercy Medical Center. The medical staff is not the administration of the hospital, and as such, we are not here to respond on behalf of the hospital to the various allegations that have been made. Nor are we here to address the case of any particular patient. We will not do any patients the disservice of commenting publicly on their confidential medical information or the care they received. Our statements will relate only to what our experience as physicians who practice here tells us about Mercy Medical Center's dedication to patient safety and to providing the best care for our patients. Following our comments, we will respond only to questions relating the experiences we have had with our patients in this hospital. Thank you for your attention. Next, Dr. Robert Curran, the Vice President of the Medical Staff, will speak.
Good afternoon, everybody. My name is Robert Curran. I'm the Vice President of the Executive Committee of the Medical Staff at Mercy Medical Center. I'm a board-certified internist who has been on staff at Mercy Medical Center for the past 15 years and have been a member of the Executive Committee for the past 5 years. My father, a retired physician, was on staff at Mercy Medical Center for 35 years before he retired. This event is unprecedented. In the nearly 100 years of its history of service to the Long Island community, there has never been the need for physicians, supported by nurses, physician assistants, and other hospital staff, to gather together for the purpose of confronting the defamation of this institution. Mercy Medical Center was founded by the nursing sisters of the Congregation of the Infant Jesus, who believe that God resides where healing is the mission. And over the decades, Mercy Medical Center has provided safe, high-quality medical care for countless people. The allegations that patients are in danger at Mercy Medical Center are simply not true. As physicians who treat our patients here, we see every day that at Mercy Medical Center, close attention is paid to patient safety and to providing the highest standard of care in a compassionate environment. Unfortunately, that fact has been swept away in a storm of sound bites, photo ops, and baseless accusations. In the fullness of time, the truth will become clear. But for now, we stand behind Mercy Medical Center. We put our reputations next to its name. We are proud to be associated with the people in this room who come here every day for the sole purpose of helping people to get better. We are proud to be associated with Mercy Medical Center. Thank you, and I'll pass the microphone over to my colleague, Jan Koenig.
Good afternoon, everybody. My name is Jan Koenig. I'm a board-certified orthopedic surgeon, and I've been the Director of Orthopedic Surgery at Mercy Medical Center for many years. I've been a member of the medical staff of Mercy Medical Center for 21 years. But I don't work in the same Mercy Medical Center that I've been seeing in the news media over the past week. I work in a Mercy Medical Center that is a state-of-the-art community hospital that believes in and lends every effort to provide safe, quality medical care, healing and comfort, and exceptional service with dignity and respect for all. I believe, as most of my profession do, in the team approach to patient care. One man or woman cannot do it alone. Physicians rely on physician assistants who are well-trained, qualified, and licensed professionals. Many hospitals rely on physician assistants to maintain the high level of quality care their patients deserve. I want to thank all our physician assistants for the vital role they play in patient care. It is a pleasure to work with these talented and well-trained professionals. The false allegations that have been publicized so widely have hurt the entire staff at Mercy Medical Center. And I am personally ashamed of the behavior this physician portrays himself as a healer, but whose unfounded allegations have hurt so many innocent patients and families. As I said, I don't practice in the same Mercy Medical Center that I've seen in the news media in the past week. I practice in a Mercy Medical Center where everyone is dedicated to patient safety and the highest quality care. I believe in Mercy Medical Center, not only for my patients, but for myself. I've even had 2 surgeries here in the last year. I know personally the quality and safety that every patient gets from the staff at Mercy Medical Center. Thank you. I'd like to introduce my next colleague, Dr. Dan Murphy.
Hi there, good afternoon. My name is Dan Murphy. I'm an emergency physician. I'm the director of the emergency department at Mercy for the last 3.5 years. I trained in emergency medicine in the 1980s at Cook County Hospital in Chicago. I was also promoted there to be a supervising attending physician of the emergency department and the trauma unit at Cook County Hospital. I also, in Chicago, worked at 2 community hospitals in the suburbs of Chicago, very similar in size and scope to Mercy Medical Center. That's where my wife and I first settled down and we started our family. We came to New York in 1996. I was hired after a national search to be vice chairman of emergency medicine at Maimonides Medical Center in Brooklyn, New York, where I stayed for over 8 years. After those 8 years, I was ready to be chairman or director myself, and I accepted a position as director of emergency services here at Mercy Medical Center for 2 reasons. One, to better serve my own community. I live just a couple of miles north of here in Garden City, and so that I could work closer to my wife and 4 children. This is indeed an extraordinary situation. Not because you see physicians here and physician assistants and staff members to gather and support a hospital that we truly believe in, but because the reason for all of this and this effort and this stress that it creates for us, including the time spent away from our patients, is because of the actions of a physician who has issued a series of false allegations that have raised baseless fears about patient safety at Mercy Medical Center. Dr. Colantonio is in fact completely, and I pray only temporarily, responsible for corrupting the quality improvement process at Mercy Medical Center, which is based on self-reporting, insight, surveillance, measurement, and peer review. He's ruined it. I pray that it's just for a few weeks, and it is the same in every hospital throughout these United States. The unsubstantiated claims of this man are part of a calculated effort to damage the reputation of Mercy Medical Center by a lawyer physician who tries to portray himself as a hero or whistleblower, but in reality has absolutely no insight about his own shortcomings, his own weaknesses. and is seeking retribution for disciplinary action that came from his fellow physicians, his peers. In the past decade, over 1,000 clinicians have been credentialed and privileged to work at wonderful Mercy Medical Center. I am told that only 3 clinicians in those 10 years have warranted the severe disciplinary action received by Dr. Colantonio. As a lawyer, as well as a physician, Dr. Colantonio understands precisely what he can allege without having to stand up to the scrutiny of facts or documentation. As he knows full well, the hospital cannot respond with details that would reveal his accusations to be false because the hospital must abide by the confidentiality laws. As important as the law, I'm not a lawyer, the professionals you see before you who have sworn the oath of Hippocrates would never do our patients or their loved ones the disservice or the dishonor of describing their precious personal and private health care issues in a public forum. In addition, and just as egregiously, Dr. Colantonio has taken advantage of a lack of public understanding about the role of very valuable members of the hospital care team, specifically physician assistants. He would have people believe that the dedicated professionals, such as the many who stand behind me, or sit behind me, excuse me, are unqualified and undersupervised or unsupervised, when in fact, they are highly trained and perform their tasks at the direction and under the direct supervision of physicians, such as me. When I work at Mercy, I am working side by side with physician assistants and signing off on their work. I presently employ 8 physician assistants. They are valuable, even precious, to this physician being able to provide the care that is necessary for my patients. In my opinion, Dr. Colantonio has directly insulted thousands of highly trained credentialed licensed physician assistants in this country with his self-serving and false manipulations. It's the same as taking on this country's firemen or policemen or military, all for personal gain. So let me wish you a happy St. Valentine's Day. Look around this room. There is a collective integrity in front of you that is not found in Dr. Anthony Colantonio. We will not be silent in the face of this character assassination. We will not allow this hospital to suffer the actions of a single individual whose agenda has nothing to do with medicine and everything to do with inflicting pain. For the love of mercy, we stand here together as one.
Now I'd like to introduce Mr. John Holloway, physician assistant.
Okay, thank you very much. It's a great opportunity to meet with you today. I'm John Hallowell, Vice President of the New York State Society of Physician Assistants. I'm here on behalf of the Society, responding to recent articles and newscasts reporting on allegations of instances of poor care at Long Island Hospital. These allegations have caused quite a stir, not to mention quite a bit of public speculation about the medical training, credibility, and capability of physician assistants. Whether intended or not, many readers and viewers have been left with a less than positive perception of physician assistants. The New York State Society of Physician Assistants represents the interests of PAs throughout New York State, a state in which more PAs work than in any other state in the country. We want to express our deep concern about such misrepresentation of our profession, especially when our profession